Okay, let's talk about something pretty common for a lot of men. Urinary issues, inflammation, concerns about prostate health. It comes up a lot.
It really does. And getting clear, practical info can feel, well, a bit overwhelming sometimes.
Exactly. But looking through the sources we have for this deep dive, including a transcript from Global Health Guide, something really jumps out.
But
This surprising link to your everyday diet, one source actually calls it a silent dietary pattern, slowly harming your prostate day by day.
wow, silent dietary pattern. That's quite a phrase. It definitely makes you think, doesn't it?
Yeah.
Suggests we might be missing something really basic.
Right. So that's our mission here today. We want to dig into these sources, pull out the key facts, and basically be your guides.
Yeah, figuring out which specific foods the sources flag as potentially harmful, and just as important, which ones they say are actually beneficial for prostate health.
Okay, let's get into it. And just to be clear, we're not giving medical advice here. We're exploring what these specific sources are saying.
Absolutely. Think of it as breaking down the information presented.
So the big question we're trying to answer for you today is, based on this material, what dietary choices seem to really move the needle on prostate health? For better or for worse.
And the sources are pretty direct about it. They definitely outline foods you might want to be cautious with if prostate health is on your mind.
Okay, let's start there then. The sources suggest you should potentially avoid at all costs if you want to protect your health. That sounds pretty serious.
It's strong language for sure. And kicking off their list is something many of us eat pretty regularly: processed meats.
Ah, okay. Like sausages, bacon, hot dogs, deli meats, that kind of thing.
Exactly. The usual suspects, really. But the sources really focus on the processing aspect.
What do they mean by that?
Well, they go through a lot of industrial processing, right? Often involving chemical preservatives, things like nitrates and nitrates. And the issue is, inside your body, these can also change into compounds that are linked to a higher risk of some cancers, including prostate cancer, according to these sources.
Wow. So it's not just about, say, the fat, it's the chemicals they add.
That seems to be a major point they make. And on top of that, these foods are usually packed with sodium, extremely high.
Right. Salt. Bad for blood pressure.
Yes, but the sources connect high sodium to more than that. Fluid retention, strain on your kidneys, your whole urinary system.
Which is tightly connected to the prostate.
Precisely. So that strain can make urination more difficult, maybe even raise the risk of infections.
That makes sense. Pressure on the whole area. And I assume they mentioned the fat, too. Saturated and trans fats.
Oh yeah, we know they raise bad cholesterol, but the sources link them specifically to promoting chronic inflammation throughout the body.
And inflammation seems to be a recurring theme in prostate issues, doesn't it?
Absolutely. It's repeatedly highlighted in this material as a direct link to conditions like BPH, that's benign prostatic hyperplasia or enlargement, and also cancer.
Okay. Anything else on processed meats?
There's also a note about hormones. Frequent consumption might disrupt male hormones, like testosterone, which could affect prostate function down the line.
Hmm. So the message isn't just eat less bacon, maybe. It's understanding that the processed versions have these specific chemical, sodium, and fat issues that this material links to prostate risk.
Exactly. And the alternative suggested is pretty straightforward. Choose fresh, natural protein, chicken, fish, eggs, lean beef, or, make your own burgers or sausages at home where you control what goes in.
Got it. Okay, what's next on the avoid list, according to the sources?
This one might surprise some people because we often think of it as healthy. Excessive consumption of dairy products.
Dairy. Interesting, but they say excessive, right? So not cutting it out entirely.
That seems to be the key word, yes. The concern highlighted centers on a substance called IGF-1, insulin-like growth factor 1.
IGF-1. Okay, what does that do?
It's a growth factor, naturally found in milk. But according to these sources, high levels of IGF-1 in the body have been shown to stimulate cells to grow in an uncontrolled way.
Uncontrolled cell growth. Yeah, that definitely sounds like something you want to avoid when thinking about cancer risk.
Exactly. The sources also bring up the natural hormones present in dairy, like estrogen and progesterone.
Hormones in milk.
Yep. And consuming large quantities could potentially disrupt the natural hormonal balance in men.
Which could lead back to that inflammation and abnormal growth risk.
Correct. Especially, they note, for men who might already have a family history or a genetic predisposition to prostate issues.
Anything else with dairy?
There's also a mention of casein, which is a milk protein. For some people, casein can trigger inflammation.
And that inflammation could potentially irritate the prostate itself, leading to symptoms.
Potentially, yes. Things like urinary discomfort, maybe having to get up more at night, that sort of thing.
Okay, so multiple potential issues with high dairy intake, according to this material. If someone does consume a lot, what are the suggested alternatives?
They suggest things like plant-based milks, almond, oat, coconut milk are common ones, soy or coconut yogurts instead of dairy yogurt.
What about cheese?
They suggest moderation, maybe opting for less processed or lower fat types like ricotta or cottage cheese. And natural unsweetened yogurts might be better than flavored ones.
Right, makes sense. Okay, what's number 3 on the list of foods to approach with caution?
Next up are foods high in saturated fat. This is a broader category than fried foods, fast food, fatty cuts of meat.
Feels a bit related to the processed meat point, at least the fat aspect. What's the main issue highlighted here?
Again, it's a big driver of systemic inflammation. That low-grade chronic inflammation that seems so central to prostate conditions like BPH and cancer, according to these sources.
Okay, inflammation again. Anything else?
Yes, they add another angle. The impact on circulation.
How does that work?
Well, too much saturated fat contributes to plaque buildup in arteries, right? This reduces blood flow throughout the body.
Meaning the prostate doesn't get as much oxygen and nutrients.
Exactly.
Yeah.
Which could impair its function over time.
Yeah.
And there's another potential link, mention hormones again.
Oh.
Diets high in these fats might raise levels of free testosterone. And while testosterone is crucial, excessive free testosterone could stimulate abnormal cell growth, particularly if someone's already predisposed.
So it's hitting from multiple angles. Inflammation, possibly circulation, and maybe hormones. The advice then is pretty clear.
Yeah, cut back on these or swap them out, replace them with healthier fats.
Yeah.
The sources point to omega-3s from fish, olive oil, nuts, avocados, those kinds of things.
Got it. What's number 2 on the caution list?
Number 2 is excessive alcohol consumption. And the sources are pretty careful here to distinguish between, say, an occasional drink and frequent or heavy drinking.
That's an important distinction. So what does excessive alcohol do, according to this material, specifically regarding the prostate?
It seems to have a direct impact on hormones. The sources state it can increase estrogen levels while potentially lowering testosterone production.
Ah, creating that hormonal imbalance again.
Exactly, which could create conditions favorable for inflammation and abnormal growth in the prostate.
Okay, hormones. What else?
It also seems to act as a direct irritant to the bladder and the prostate itself.
Leading to those uncomfortable urinary symptoms we sometimes hear about.
Yes, exactly. Things like needing to go more often, feeling like you haven't fully emptied your bladder, or just general discomfort down there. And another point they make, which I hadn't fully connected before, is dehydration. Alcohol's a diuretic, right? Makes you pee more.
Yeah, definitely feel thirsty the next day.
And that dehydration leads to more concentrated urine, which then further irritates the bladder and prostate. It can also increase the risk of urinary tract infections and inflammation.
Interesting connection, so staying hydrated is key.
Absolutely.
Yeah.
The sources really stress drinking plenty of plain water to help flush toxins and keep the urinary system working smoothly.
So the big message with alcohol is moderation.
Moderation seems key, yes. Reducing how often and how much you drink. They even gently suggest that maybe a small glass of red wine might be less irritating for some than, say, lots of beer or spirits. And balancing any intake with a diet rich in antioxidants is probably wise.
Okay, and that brings us to number 1. The top food or category the sources flag for caution. What is it?
Topping their list, and they call it the silent enemy, is refined sugar and simple carbohydrates.
Silent enemy. That sounds pretty bad. Sweets, sugary drinks, white bread, white pasta.
That's the stuff. The main issue highlighted is how quickly they mess with your blood sugar.
The spike and crash.
Exactly. You eat them, your blood sugar shoots up, your body releases a surge of insulin to deal with it.
And those insulin surges are the problem.
They connect back to chronic inflammation. The sources repeatedly link this kind of inflammation, driven by blood sugar swings, to prostate enlargement and potentially disease.
Okay, inflammation yet again.
And there's more. That excess sugar is strongly tied to weight gain, especially abdominal fat, belly fat.
Which we know isn't just passive fat, right? It messes with hormones.
Precisely. Abdominal fat can decrease testosterone and increase estrogen levels. Another hormonal imbalance, which the sources say fuels prostate growth.
And it creates a bad cycle too, doesn't it?
It does. The sources describe how the rapid digestion leads to that spike, then a crash, which leaves you feeling hungry again quickly, often craving more sugar.
A real vicious cycle.
Totally. And over time, this can lead to insulin resistance, which isn't just linked to diabetes, but according to these sources, it's also tied to faster prostate cell growth and potentially even prostate cancer.
Wow. Okay, so it's not just about avoiding junk food in general. These sources draw really specific lines connecting refined sugar and simple carbs directly to prostate health issues through inflammation, hormones, and cell growth signals.
That seems to be the core message. But the good news is they offer clear alternatives.
Like what?
Complex carbohydrates, things like oats, brown rice, quinoa, whole grain breads. These release energy slowly, don't cause those dramatic spikes, and give you fiber.
And fruits.
Yes, especially low glycemic fruits like apples, pears, berries. They have natural sugars, sure, but also fiber, antioxidants, vitamins, stuff that actually fights inflammation. The goal isn't necessarily zero sugar ever, but being much smarter about your sources, focusing on whole, unprocessed carbs.
Makes sense. So we've covered the foods the sources suggest approaching with caution. Now let's flip it. What about the foods they say actively protect and strengthen the prostate?
Right, the positive side, let's get into the foods to include.
Okay, what's number 5 on the good list?
Starting off, the beneficial foods. Tomatoes.
Tomatoes. Often touted for health benefits. What's the specific connection to the prostate here?
It really comes down to one key compound, lycopene. That's the pigment that gives tomatoes their red color.
Lycopene. Right, heard of that? What does it do?
It's a really powerful antioxidant. And these sources emphasize its role in potentially helping to prevent prostate cancer and also possibly reducing prostate enlargement, BPH.
How does it work?
Essentially, it fights oxidative stress. That's damage to cells caused by unstable molecules called free radicals. Oxidative stress is a big driver of aging and abnormal cell growth. So lycopene kind of forms a protective barrier against that damage in the prostate cells.
A protective barrier. Interesting. And wasn't there a tip in the sources about absorption? How to get the most lycopene?
Yes, good point. Lycopene is actually absorbed better by your body when tomatoes are cooked lightly.
Oh, really? So cooked is better than raw for this?
It seems so, for lycopene absorption specifically. So things like homemade tomato sauces, tomato soups, even roasted tomatoes might give you more of that beneficial compound.
Good tip. Changes how you might think about using them. Do they offer other benefits too?
They do. The sources also mention vitamin C and potassium in tomatoes. These help support your immune system, reduce inflammation, and also play a role in regulating blood pressure and even muscle function around the bladder.
Okay, tomatoes. Got it. What's number 4 on the include list?
Next up, cruciferous vegetables. Think broccoli, cauliflower, cabbage, kale, that family of veggies.
The brassicas. Okay, what's the key player here?
The star compound highlighted is sulforaphane. It's known for having really strong antioxidant and anti-inflammatory effects.
Anti-inflammatory again, connecting back to what we talked about with the avoid foods.
Exactly. Sulforaphane helps your body's natural detoxification processes. It supports the liver in flushing out harmful substances. The sources suggest this detox support is important for preventing prostate inflammation and disease.
Does it connect to hormones at all?
It seems so. They're noted for potentially helping to lower excess estrogen levels and supporting healthy testosterone production, helping maintain that crucial hormonal balance.
Interesting. Anything else specific about these veggies?
Well, broccoli gets a specific shout out for being high in fiber. Good fiber intake helps digestion, obviously, but it can also prevent constipation and bowel pressure, which could indirectly impact prostate comfort.
Right, less pressure in that whole area. Okay, number 3 on the good list.
Number 3 is something small but apparently quite mighty. Pumpkin seeds.
Pumpkin seeds, pepitas. What makes them so good for the prostate, according to these sources?
Don't underestimate them. They are absolutely loaded with zinc. Zinc is highlighted as essential for regulating testosterone and protecting the prostate.
Zinc. I know it's important, but specifically for the prostate.
Very specifically. It supports healthy cell renewal and keeps hormones stable. And critically, the sources link zinc deficiency to a higher risk of BPH, prostate enlargement.
Wow. Okay, so getting enough zinc is really key.
Seems crucial based on this material. Pumpkin seeds also contain phytosterols.
Phytosterols, what are they?
They're plant compounds that studies suggest can help reduce levels of DHT, dihydrotestosterone.
DHT, I've heard that linked to prostate enlargement too. And hair loss.
Exactly. DHT is a hormone strongly connected to prostate enlargement, so phytosterols might help manage that. And pumpkin seeds also provide omega-3 fatty acids.
Omega-3s again. Good for inflammation.
Yes, helps lower inflammation, and also improves blood circulation. Both good things for the prostate.
Okay, pumpkin seeds pack a punch. What's number 2?
Coming in at number 2 is green tea. The sources describe it as a powerful natural drink for prostate health.
Green tea. What's its secret weapon?
It's rich in a type of antioxidant called catechins. Epigallocatechin gallate, or EGCG, is the most famous one.
Antioxidants. So, fighting inflammation and cell damage again.
You got it. They help reduce inflammation, combat those damaging free radicals, and the sources even point to research suggesting catechins might help inhibit the growth of abnormal prostate cells.
Really? Inhibiting growth.
That's what some studies suggest. Green tea consumption has been associated in research with a lower risk of prostate cancer and also better urinary function.
Better urinary function, too. How does that work?
Well, the sources mention it acts as a gentle, natural diuretic. This helps your body eliminate toxins and improve fluid balance, which can potentially help with urinary flow and comfort.
Interesting. Any tips for drinking it?
The main tip is simple. Choose natural, unsweetened green tea. Avoid the processed versions loaded with sugar, which would kind of defeat the purpose, right?
Right. Avoid adding back the silent enemy. Okay, and that brings us to the number 1 food highlighted for prostate health in this source material. What is it?
The top recommendation is omega-3 rich fish.
Like salmon, sardines, tuna, trout.
Exactly those types.
Yeah.
They're packed with omega-3 fatty acids, EPA, and DHA. And the sources describe these fats as among the most effective natural anti-inflammatories you can eat.
Inflammation again. It really seems to be the central theme running through all of this, doesn't it?
It really does seem to be a major factor according to this material, yeah. Omega-3s are great for fighting inflammation, but they also help regulate hormones, improve circulation, which ties back to that point about getting enough blood flow to the prostate.
Right.
And they may help protect the prostate from uncontrolled cell growth. They might also help prevent that excessive DHT buildup we mentioned earlier, really supporting long-term prostate health on multiple levels.
So they're hitting inflammation, hormones, circulation, cell growth. Quite comprehensive.
It seems that way. The sources suggest eating these kinds of fish regularly, aiming for maybe 2 or 3 times a week. They state this level of consumption could significantly reduce the risk of prostate cancer and dysfunction.
2 to 3 times a week. What if someone doesn't eat fish?
They do mention omega-3 supplements as an alternative, fish oil or algal oil, but they advise talking that over with a doctor or a health professional first.
Good advice. Okay, so stepping back now, looking at the whole picture painted by these sources, the foods to be careful with, the foods to prioritize, it really hammers home how specific the link between diet and prostate health appears to be.
Absolutely. It's not just vague eat healthy advice, is it? It's about understanding why certain foods might matter. Knowing about lycopene in tomatoes or sulforaphane in broccoli, or the issues with nitrates or sugar spikes.
Yeah, understanding the specific compounds, the mechanisms like inflammation, hormone balance, cell growth, that feels like the key takeaway.
It really does. It moves beyond just following a list, doesn't it? It empowers you, the listener, to grasp the processes described in these sources and make more informed choices based on that understanding.
And this deep dive really makes you think, doesn't it? How these seemingly simple everyday choices, what you put on your plate, can have such complex, intricate and long-term effects on specific parts of your body, like the prostate.
It definitely does. Which leads to maybe a final thought for you to consider. How does understanding this detailed connection, this link between specific foods and the health of one particular organ, how does that change the way you think about your own daily eating habits more broadly?
That's a powerful question to chew on. We really hope this exploration of the source material has offered some useful insights into how diet fits into that whole complex picture of prostate health.
There's always more to learn, of course, so we definitely encourage you to keep exploring these connections for yourself.